Atrial fibrillation is a chaotic, irregular beating of the heart. When the heart beating is irregular, there will be stasis or stagnation of blood within the heart chambers. When there is stagnation of blood within the heart chambers, this will lead to clotting of the blood, and these blood clots can get dislodged and land up in the brain, leading to a brain stroke. So, in the treatment of atrial fibrillation, there are two important strategies, both have to be done. First strategy is to control the atrial fibrillation or treat the atrial fibrillation. Control or treatment of the atrial fibrillation is by the use of medications which can control the rate, like beta blocker, calcium blocker, Amiodarone and so forth. Or we can bring back the atrial fibrillation to a normal sinus rhythm. So, that can be performed with a new set or a set of drugs called the anti-arrhythmic drugs. Even though the anti-arrhythmic drugs are useful in the treatment of atrial fibrillation, the problem was they were associated with a high incidence of side effects because of the medicine. So, the other option what has evolved for the treatment of atrial fibrillation is the electrophysiological study and catheter ablation. So, in this therapy what we do is we map where is the focus or where is the location from where the atrial fibrillation is originating. Once the focus or the site of origin of atrial fibrillation has been identified, then electrophysiologists isolate the location of this irregular heartbeat and isolate it from the rest of the heart. So, they will create pockets or islands of chaotic beating which are separated from the rest of the heart tissue. So, in effect, these, even though there are micro pockets, these pockets are in no way going to affect the heart. Over the last 3 years, there was lot of data which has been generated which showed that patients with atrial fibrillation, when they undergo catheter ablation, they were doing much better in the form of reduction in the death rate, reduction in the hospitalization rate, reduction in the heart failure, and the quality of life is also much better when they undergo a catheter ablation. The second strategy which has to be adopted in a patient with atrial fibrillation is the prevention of brain strokes. The most dreaded complication in atrial fibrillation is development of a brain stroke. So, to prevent the development of brain stroke, we need to ask the patient to take anticoagulants. Anticoagulant means, coagulation means blood clot, anti means opposite. So, those medicines which act against the blood clot are the medicines which we need to use for these patients. For the past 5 decades, we have the vitamin K antagonists like the esinocumarol or the warfarin, which can be used for the prevention of blood clot formation or propagation of the blood clot formation. So, these anticoagulants, also called as the vitamin K antagonists, there are 2 types, warfarin and esinocumarol. Both have been used extensively with good results. They were effective in preventing the stroke, but the main challenge with these older generation of anticoagulants is the increased chances of bleeding with the vitamin K antagonist. To overcome the problem of increased bleeding, over the last 8 to 10 years, we have 3 novel oral anticoagulants or direct acting oral anticoagulants. They are called Novac or Dovac, and they have been used to anti or fight the blood clotting tendency. They are called Dovac or Novac. These drugs are either like the dabigatran, rivaroxaban and apixaban. and edoxaban. These are the different types of novel oral anticoagulants which are available in the market. The first three, except the edoxaban, are available in India. These drugs, compared to the previous generation of warfarin and isinocumarol, are cause less complication of bleeding. So, the bleeding complications are less with a similar efficacy as that of a vitamin K antagonist. That is why current day atrial fibrillation is mostly with Novac in the form of either dabigatran, apixaban or rivaroxaban. The third type of therapy which is used in the treatment of atrial fibrillation for prevention of blood clots is the left atrial appendage occluder. So, what is this left atrial appendage occluder? We already understood that those patients who have got atrial fibrillation have an ineffective heart beating ability. So, there is stasis of the blood clot there. So, where is the blood clot happening? The blood clots are happening in the left atrium. So, the left atrium, in the left atrium, there is a finger shaped structure called the left atrial appendage. There is no real major function of the left atrial appendage, but this appendage is a very important focus for the development of blood clots. So, what nowadays the cardiologists are doing is to block or block the left atrial appendage by using a left atrial appendage occluder. The alternative for this is to remove the left atrial appendage is at the time of surgery. That is what they do is a left atrial appendage ligation. The therapy of left atrial appendage occluder is very useful for those patients who cannot tolerate oral anticoagulants, who have a high risk of bleeding of oral anticoagulation, people who refuse to take anticoagulation or who cannot be relied upon to consistently take anticoagulation, and those patients who are at a high risk of having a thrombotic or a embolic complications because of the atrial fibrillation. Those are the groups. In addition, a person who is already on anticoagulation still develops a brain stroke. That is also another indication for use of a left atrial appendage occluder. Finally, those patients, as we have just now understood, when they undergo a catheter ablation or an electrical isolation, it is preferred to perform a left atrial appendage occluder because this type of atria, there are a lot of pockets of non-functioning atria, making it more prone for development of left atrial thrombosis. So, in conclusion, left atrial appendage occluder is an elegant therapy for those patients who cannot tolerate anticoagulants, who have got contraindications or where we cannot use anticoagulation, those who develop complications because of anticoagulation, those who refuse to take anticoagulation, those who cannot be relied upon to take anticoagulation, and those people where on an anticoagulation if the patient develops stroke. Those are the groups of people where left atrial appendage occluder is an elegant therapy to prevent the problem of brain stroke in atrial fibrillation.